segment. And as we promised, meron po kami live demonstration of a new machine. But before anything else, on behalf of Dr. John Seneca, I'm Dr. Aaron Lau, and my co-host for today, Mr. Ansel. Hindi ko na kailangan banggitin ang apelyido kasi kilalang kilala nito. Sa buong Pilipinas.
Ayan, magandang hapon po.
Yes. Before tayo natapos kay Dr. Mangkaw, may ginawa na naman si Dr. Mangkaw.
Yeah.
Follow up lang.
Pinahiga niya ako at mayroon siyang, again,
how do you feel?
yeah, much better.
Much better na naman.
Pwede na akong mag-marathon ito.
Yes. And second segment, ito ang facelift. Ibig sabihin, baba natin ang mukha mo na non-surgical, walang
Non-surgical,
opera, walang iwa.
okay.
Yes. And to talk about this product or new machine is no other than the skin and laser specialist of Luminisce, no other than Dr. Kaycee Reyes. Napakaganda naman ni Dr.
Magandang hapon. At kasama din natin, tutulungan niya rin tayo, mula siya ang sales manager ng Hornet Radiant Technologies, si Queen Ikogo.
Queen, no? Yes. And ating demo patient, itago na lang natin sa pangalan. Rose.
Ayan.
Of Energet. Yes. As we can see sa ating mga televiewers, Ansel, ano po ba yung machine na nandito sa tabi ng ating pasyente, Doktora?
So this is Energet. It's a needleless jet injection of healing compounds. So we use kinetic energy in combination with infusion of hyaluronic acid.
Wow. Okay.
Yes.
So needleless ito.
Needleless.
And ano
So, hindi masakit.
Tolerable. Hindi kasing sakit ng needle. Mas masakit yung needle. Tolerable.
Very tolerable.
Kasi with needle, ang mas masakit po with needles eh. With this one, you use the kinetic energy. So you create a microtrauma. With the microtrauma, there will be a tightening of the fibroblasts. With the tightening of the fibroblasts, it will stimulate growth factors and collagen build-up.
Ano yan? Para lang yan sa mukha?
We use this for skin lifting, facial lifting, and tightening.
Ano pang indication, Doctor?
And then we can also use this for scar remodeling. We use this for acne scars, surgical scars, even for stretch marks, and even for keloids. There's a new study that we infuse tranexamic acid with this, in the solution, and then we treat melasma with this Energet.
Wait, I'm interested in that kasi
Yes.
ang melasma, Ansel, ito yung parang may mapa
Yes,
sa mukha
yes.
na aggravate with sun exposure. Ang dami may problema nito lumalapit sa atin.
Yes.
You infuse tranexamic acid.
Yes.
And tranexamic acid is for yung mga para mapatigil ang dugo, right?
Yes.
Yo.
Yeah. It's a new study because with melasma, there's a VEGF factor. So there's a vascular component of melasma. That's why we need to target that. It's not only the pigments. And
Nakita ko babae yung model natin, pero pwede din ba yan sa mga lalaki, Dok? Sabi nila
Oo
kasi
naman po.
magkaiba daw ang skin ng babae at ng lalaki.
Kasi we also use this for dermal thickening, like for chest and for the dorsum of the hands. To make it thickening. I mean,
kapalin natin?
yes.
Kakapalang mukha
Actually,
ko.
yes.
Parang hindi yata maganda.
Kasi,
Siguro pag may kasalanan, makapal muna tayo. Pag uwi sa bahay, pag sinampal,
Pero yung mga makakapalang mukha, pwede rin panipisin.
yes, actually, ang Asians po, we have thicker skin compared to Caucasian. So what we do, we just adjust the pressure depending on the gender and the race and the thickness of the skin of the patient. Because this machine, it's different from other machine. Like with laser, it can only target like 1.5 millimeter deep. So it's just the upper layer ng dermis ng mid-layer yun ng skin. And then if you use RF, it can go as deep as 3 millimeter, which is the subdermal, sa ilalim ng dermis, sa ilalim ng middle ng skin. And then if you use HIFU, which is the a new technology also, it can go as deep as 4 to 4.5 millimeter, which is on the subcutaneous tissue and the SMAS, the aponeurotic system. But this machine, what it can do, it can go from 1.5 millimeter deep to 6 millimeter deep. So it can promote skin rejuvenation, and we can also target facelifting, tightening. Because if you target the subcutaneous tissue and the muscle, it will promote contraction. Yes. And if we're infusing hyaluronic acid, which also attracts water.
What is hyaluronic acid, Doktora?
Hyaluronic acid, actually all vertebrates has hyaluronic acid.
Yes.
But with humans, we have more So it's a natural composition of the skin. What it does, it attracts water and it promotes collagen remodeling. So once it attracts water, it will hydrate your skin.
Hydrate.
Rejuvenation
And
din
then
pala ito.
collagen formation, skin rejuvenation.
Oh, okay.
Yes.
So, siguro start tayo. May preparation ba ito, doktora? Do the patient need to be put to be yung anesthesia sa face or topical anesthesia or wala?
We just put topical anesthesia
Topical.
for 20 to 30 minutes.
Okay. Ang for our televiewers, ang topical anesthesia po is hindi po tusok ito.
Hindi.
Okay.
Just
Ito
the
po, ipapahid
cream.
lang po. It will stay there for 20 to 30 minutes.
Yes po.
And then we'll do the procedure.
Yes.
Okay. Siguro sa demo patient natin, doktora, please explain kung ano ba ang problem and ano po yung gagawin natin.
For this patient, the patient is relatively young. She's 34 Rose, no? So,
24.
okay.
24.
So, what we do, we're
Kala
just
ko
going,
14. Ay, hindi.
and her main concern is facelifting.
Okay.
Because at this age, at 30, we start to lose collagen. And most of the female population, they want instant lifting. So, this is a good machine for that. So, we're going to make a lifting, the brow lifting.
The eyebrow.
And then, it depends on the vector. You can put the shots here to lift this one and to lift this one.
Is
So,
this
it will
instant,
lessen.
doktora? After
Instant.
the procedure, can we see the lift again?
Yeah, because there will be muscle contraction.
Oh.
But you will see the definite lifting after 2 weeks.
After 2
Because there's the immediate effect, which is the skin hydration and muscle contraction tightening. But after 2 weeks, there will be the collagen remodeling.
Yun, collagen remodeling. Okay.
But I suggest 3 treatments of this one.
Three treatments.
Yes,
Yung
once a
price na
month.
meron
Span
na
of
usapan
1
niya.
month.
Once a month for 3
Once a
treatments
month.
because after collagen build-up, the first session, you need to add more collagen build-up,
Follow up mo pa yun
follow
para
up
mas
for 3
maganda ang
sessions.
effect. Oo,
Yes.
siguro, start tayo.
Okay, I'll start na.
So, we'll start on the
So,
forehead muna tayo.
forehead to lift
Okay.
this one.
So,
Hindi naman delikado yun, hindi ako magdadasal ha.
Pwede po. What I do, I pray every time I do
okay.
the patient.
yes, to all
Every
our
time.
televiewers, huwag niyo pong gagawin sa bahay ito, ha?
Apo.
Yeah,
Start.
it's been done by an expert doctor who trained for this, no?
1, 2, 3. Kaya.
So,
ganun pala yun.
So, you create a bump.
so
This
makikita
one-
natin parang meron siyang nakaumbok after.
Yes. This one, yung pressure na ginamit ko, it will be up to 2 millimeter deep.
2
Sa
millimeter
dermis po muna.
Okay.
Then I'm going to increase my pressure para tumama sa smash, para may instant
Para
lifting
may
later.
lifting. Okay.
Yes. So I'm going to do the first layer. It's 35, no?
Yes.
So I do 50 to 80% overlap. So if you do this with needles, it's very painful.
Yes, so lalo na dyan sa may hairline banda, medyo
Yes.
masakit na area yan, no?
Yes.
Kumustahin naman natin si Rose, kapangalan ng mother ko. Rose,
Kamusta
kamusta?
ka, Rose?
Kamusta ka? Okay naman. Okay naman, nakakangiti pa, ano? So sa tingin natin, hindi talaga siya
Teka,
masakit,
tingnan
no?
ko ha. Umiyak ba siya? Nagpapanggap lang ba siya? Ay, hindi naman eh.
Totoong nangingiti siya. Oo.
We can also use this for the chest
For the chest.
and the necklines. Kasi for after pregnancy,
Chest, you mean sa lalaki or
pwede din po.
breast?
Dito po. Sa area na
pwede
to.
sa chest
Okay.
area.
Yes, may text lang tayo. Cellphone ending at 3363. Ansel?
Ayan, ask ko lang kasi po nakaka-offend ang pagkakaroon ko ng pekas.
Pekas.
Ano po pwede ko gamitin para mo-avoid ito mula kay Aubrey Villanueva ng Palawan.
Opo.
Bakit naman nakaka-offend ang pekas?
Siguro, hindi ko rin alam eh. Siguro may mga pasyente na para nahihiyang lumabas. Na parang pag marami silang pekas sa mukha, inaasar sila. Doktora
So,
Kaycee,
yes.
pwede po ba daw ito sa pekas?
Pekas po, what we do, pinaka-important is you apply sunblock. The most
Sunblock.
important. Because if you treat the pekas with lasers and with topicals, and if you don't apply sunblock, it will just come back. So the important one is you use at least SPF 30 sunblock.
30 SPF, sun protecting factor.
Yes,
Ito po
at
yung
least
ano,
SPF 30 and you apply it every 4 hours. So
every
that's
4 hours.
So that's 2 to 3 times a day because the half-life of sunblock is 2 hours. So after 4 hours, wala na siya. most important is the frequency, how frequent you apply.
Yeah, so kasi
Yes.
minsan ang pasyente natin, Ansel, ikaw, may mga times na
Taas na
if you
natin.
go to the beach or if you go outside, once you put sunblock in the morning, we thought na protected tayo the whole day. Yun yung nagiging problem. So every 2 hours tayo dapat maglalagay, no?
Pero Doc, ang sabi ng iba, status symbol na pag medyo may pekas ka kasi ibig sabihin nun,
Cute siya. Minsan po cute siya,
Cute
pero
daw
pag
kapag
marami
may
na,
pekas. Pag marami na.
nagpo-progress po kasi. Okay lang yung mga konti, cute siya, pero okay lang yung mga 20, mga freckles. But pag 40 ka na and you have lots of pigmentation, it's a sign of aging po kasi the most common sign of aging for Asian is pigmentation. For Caucasian, it's wrinkles.
Alam mo, Dr. Lau, Dr. Lau, itong si Doktora
Reyes.
mismo, ditong si Doktora Reyes, kung titignan mo ang kanyang mukha, napakaganda niya, di ba?
Yun,
Napakaganda niya.
Papa-energy.
Ano yan? Kalikasan ba yan? Ano ba
Okay
yan?
po.
O biyaya ng Diyos.
So,
Biyaya ng
lagi
Diyos
ko-
ba yan? O gumagamit ka din itong Energet na ito, Doc?
So I always tell my patient, yung age, yung beauty is like 30% by nature and 70% by nurture. So genetics, 30%
by nature,
and 70% by nurture.
nurture.
So 30% genetics and your race, and then by 70% it's your lifestyle. Yeah,
So
like
lifestyle
your
very
chronic sun
important.
exposure and smoking.
Yeah, so lalo na sa Palawan na katabi ng beach,
Lifestyle,
napakainit, no?
Meron pa tayong
Yes, yung cellphone number ni Dr. Mangkaw, siguro ifo-forward po natin mamaya sa inyo, no? Sa lahat ng mga nag-text po regarding kay Dr. Mangkaw.
Yes.
So, kamustahin natin ulit ang pasyente natin?
With the pecas po pala, we can do laser to remove the pigments.
Laser.
Hindi naman
Laser.
luha yan eh, no? Hindi ka naman umiiyak. Hindi, natamaan lang ng ilaw, kaya kumikislap.
Pain scale
Ah,
nasa
pain
2.
scale.
1 to 10, 10 ang pinakamasakit. 2 ang pain scale. Okay, so very tolerable. Gaano katagal, doktora, ang procedure?
15 minutes.
15 minutes.
15
So,
minutes.
siguro tapusin na natin yung one side para makita ng televiewers natin ang
yes,
effect, no? Other part of the body, doktora, na pwedeng gamitin ng energetics?
Neck, and
Neck.
and then hands,
Hands.
and then
Abdomen.
the abdomen for
Abdomen.
stretch marks.
stretch
Oh,
marks.
okay.
Because-
Kasi my wife, kakapanganak lang na 3 months.
Ayan.
Oo.
That's-
Talagang, how soon yung mother na pwede magpa-treat because of her stretch marks?
Ako, para safe, after lactation na lang
After
po.
lactation. Paano pag after 5 years na nagpa-dente?
Ay, nako, mas mahirap pong tanggalin
So,
ng
after
stretch
lactation,
mark.
After lactation.
Kasi yung the fibrotic strands that you create, kasi stretch marks is also a scar. There's a fibrotic strands connected to the subcutaneous tissue. So what we do with this one, we can use this one to target the fibrotic, to destroy the fibrotic strands and tanggalin siya yung hold niya sa subcutaneous tissue. So magpo-promote din ng collagen remodeling. So maganda siya.
Doc, may
Yes.
napansin ako, parang may mga lumalabas na
Pinpoint
These are
bleeding.
pinpoint
Oo,
bleeding.
bleeding. Oo. So normal yan, ano? Talagang may konting lumalabas.
Yes, opo.
Oo.
Lalo na pag patient nag-vitamin E or NSAIDs for the last 2
Kasi
weeks.
nakaka-
Yeah.
Okay.
So,
Okay,
yung
kamusta ang ating pasyente?
More pa.
Okay pa din.
Lapit na po.
Kasama yan sa investment sa ganda.
Yes.
Kasi a lot of people na papunta ng summer, talagang they go out eh.
Yeah.
Gusto
yeah.
nila, they look young. Ano ba ang ang crown ng babae? The legs or the face?
It
Ano ba-
depends.
Depends.
Kaya like yung mga lalaki, mas gusto yung face. Yung lalaki, mas
ugali.
gusto yung
Ugali
laka.
talaga.
Very nice.
Talaga?
Walang naniniwala.
Hindi naman pangit yung misis mo ah. Ang ganda-ganda ng
Ugali.
misis mo, eh.
Yes.
So yung tawag doon, swerte. Si Doc.
Swerte. Tinamaan ng swerte.
Swerte
Yes.
yun. Nandun ang lahat.
Eh siya maganda siya, ibig sabihin mo, mas maugali mo. Hindi naman, di ba? Maganda yung kombinasyon. Di ba?
Yes.
Yan. Ayan.
Sige. Tapos na ang ating, almost done ang ating treatment. Yes. Nako, unfortunately, patapos na rin ang ating show.
Dito pa.
Pwede na ba natin maipakita yan?
Yes
Yung
po.
na yan, Doc.
Sige, pakita natin saglit lang.
At habang pinapakita natin, Doc, saan ang clinic mo, Doc?
Yes.
Saan ka pwedeng puntahan?
So, my clinic is a Luminisce Skin Clinic. It's just above Mercury Drug Building, 32nd Street, 4th Avenue, in Fort Bonifacio. It's just across St. Luke's hospital.
Okay,
Yes,
okay.
kapitbahay.
Oo.
Yes, eto na po.
Mura lang ba yan? Mura lang ba yan? Yung pagpapaganyan?
Mura
Eh,
lang
di
ba to, Queenie?
Ano yan? Once, 3 times eh, no?
3 times.
Oo,
Oo.
okay.
Times.
Kamusta? Upo
Well,
natin.
for the
si
sake of beauty po, it will be cheap.
Doktora,
Yeah.
can we explain kung ano nangyari?
Okay.
Ng brief.
Queenie, start.
If we focus.
Ikaw na.
Sige.
Okay.
Nakafocus ba? Medyo nag-lift nga ang left.
Probably we
Medyo
focus.
nag-lift ng left brow.
Okay.
Oo nga,
If
nag-lift.
you notice po with this yung eyebrow,
Sige, pakifocus
if
please.
if we compare it to the
Yes,
other
okay,
side,
kita sa camera.
immediately
Medyo,
you'll
medyo.
see yung lift. And also with her lines, there's a nasolabial sa ano.
Yes,
Okay.
wow.
So because this one, parang pinupul niya yung skin.
Mm-hmm.
But because the lift is because of the solution that we introduce on her skin. But after a week, you'll see yung true lift.
Much better.
Much better until, but you have to continue with another treatment with the interval of 1 month.
So,
Pero-
kailangan mga 3 sessions tayo.
Pero
Yes,
Dok,
up to 3
gawin
sessions.
nyo rin yung kabila kasi kawawa naman kayo.
Of course,
Tabingin,
siyempre.
ano, oo.
Doktora, you've mentioned about your clinic, kung saan kayo mahanap. Any landline para ma-contact mo kayo?
So you can contact us at 02-511-8500 or cell number 0917-521-5283.
Yes. So, thank you so much, Hornet Radiant
It's Hornet Radiant.
Technologies, Dr.
Thank you
Kaycee
po.
Reyes.
Thank you, Sir
Thank you,
Ansel.
Rose. I'm sure marami na naman natuto at ang mga televiewers natin, no? And Ansel, ano ba ang
Maraming salamat. Mukhang mahihirapan ako sa asawa ko nito dahil baka subukan niya ito at subukan niya rin yung
yung mapapagastos?
Gastos.
I'm sure pag dinala mo kay Dr. Reyes,
Ayan,
mura
oo
na,
naman.
mura.
Tulad ng sinabi nga nila
Yes.
kanina, investment yan para
Yes,
sa
you
ganda.
invest in
Ah,
beauty. Yes.
Yes.
Yes, and binabati ko lang ang aking mother, birthday niya tomorrow, 63rd birthday, and to my wife Ira and to my baby Rael who is outside the studio right now.
Yes.
Yes, thank you.
Okay.
And
Thank you.
Dr. Seneca, we miss you and hope to see you next week for another episode of What's Up, Doc.
There's a tear in your eyes, I know. I can feel that it's not been dried out all these years.